Hi Grace, what is your concern today?
I've been having extreme pain and stiffness in my right knee in the morning. It's been making these disgusting popping noises and I've just been feeling really unstable. I've looked it up and I think I have rheumatoid arthritis.
I see. It could be that, but the fact that it's only in one knee has me leaning more towards osteoarthritis. Normally with rheumatoid arthritis, because it's an autoimmune disorder, it's an inflammatory response, so it normally occurs in both knees. Have you been through menopause yet?
Yes, I have.
Yeah, see, so that's another reason why I'm leaning more towards osteoarthritis, because postmenopausal women are more prone to having osteoarthritis.
But what is osteoarthritis?
I've got a video to show you. Let me just show you this and it'll make things more clearer for you.
The tibiofemoral joint consists of three articulations between osseous structures, which can be visualized in this anterior-posterior projection of a plane radiograph. There are two articulations between the femur and the tibia, the lateral tibiofemoral articulation and the medial tibiofemoral articulation. The third articulation forms between the femur and the patella, and is so called the patellofemoral articulation. A cavity exists between these structures, named the synovial cavity, which is filled with synovial fluid. Visualizing a plane radiograph of a healthy tibiofemoral joint in comparison to a case of osteoarthritis, clear differences in the anatomy of these structures is evident. A lessening in the synovial cavity space can be seen, as well as changes to the bone surface. These changes are typical in osteoarthritis patients.
The articular cartilage of the knee is made of hyaline cartilage. This tissue is avascular, though contains a high water, collagen, and proteoglycan content, which facilitates the diffusion of nutrients and mechanically aids smooth articulation and shock absorbance. When the space between the tibiofemoral joint is reduced and the synovial fluid becomes less viscous, the articular cartilage begins to wear and create microtears. Progressively, as the cartilage degrades, more of the subchondral bone of the tibia and femur become exposed and damaged. The osteocytes located in the lacunae of each bone begin remodeling in response to this damage. Osteoblasts lay down new cortical bone matrix, forming osteophytes. The formation of the osteophytes inhibit the smooth articulation of the joint, which causes pain, edema, and ongoing damage.
I was going to order a plain radiograph for my patient who I'm suspecting of having osteoarthritis. Would you say that would be the preferred modality?
Plain radiography used to be the gold standard, but even though it's cheaper and easier to access, it doesn't show enough detail. If you look at these two scans, you can see that there's very similar joint neck space narrowing with rheumatoid arthritis on the left and osteoarthritis, so it's probably not the best choice. Also, clinically significant changes often aren't visible in plain radiography for at least 1 to 2 years of disease progression. Advances in MRI technology, however, have improved its ability to visualize bone marrow lesions, osteophyte formation, and cartilage morphology, all of which make it a better choice of modality for osteoarthritis diagnosis. It's important to identify the extent of the damage to the surrounding tissues, and the popping sounds that your patients reported suggest there could be meniscal or ligamentous damage, which a T2 weighted MRI will show very clearly.
Okay, great, thank you.
Using a T2 weighted MRI, this coronal section of the tibiofemoral joint shows lesions in the subchondral bone marrow, indicated as an intermediate to high intensity signal in the lateral epicondyle of the femur and lateral condyle of the tibia. In the next image, edema and severe osteophyte formation is present in the medial tibial plateau. In this sagittal section of the tibiofemoral joint, we can locate both anterior and posterior horns of the medial meniscus. However, the posterior horn of the medial meniscus has a horizontal tear, which appears as a high-intensity signal due to the leakage of synovial fluid in the menisci. A complete tear in the medial collateral ligament is also present as a region of high signal intensity.
So I've got your results back. The blood test shows that it's negative for rheumatoid factors, which is good. That can rule out rheumatoid arthritis. Unfortunately, your MRI scan has come back that you do in fact have osteoarthritis with a little bit of tissue damage. So we're now going to talk about some treatment options for